IVM.
Hello and welcome to the Habit Coach podcast. I am Ashdin, Doctor, your habit coach. And today with us, we have a very special guest, Dr. Roma Kumar. She is a mental health specialist. And, right now we've been going through so much stuff over the last year. And I get a lot of requests on, Instagram and people writing in, listeners writing in saying that let us talk a little bit about mental health. Because, there is such a taboo about it. We don't know, should we be going to a therapist? What are the kinds of therapists? There's just so much, lack of information that is there. So I thought, let us start busting these myths. Let us actually start talking about it because it's such an important topic for discussion in today's day and age. Dr. Roma, welcome to the podcast.
Hi, Ashdin.
Dr. Roma, tell us a little bit about yourself. How did you get into this world? What is it that you do?
Okay, so I'm a psychologist and I've been in this profession over 3 decades now. And I've done my bachelor's, my post-graduation and my doctorate in psychology. And I've been trained in various mental health disorders from both India, abroad, which is America, as well as Canada. And I am presently the Vice Chairperson of the Department of Psychiatry and at Sir Ganga Ram Hospital. I'm also with the Institute of Child Health at Sir Ganga Ram Hospital. I am also a senior consultant with the Max Hospitals, Gurgaon. And I run my own clinic by the name of Saksham, which is Child Guidance and Adolescent Guidance Clinic. And of course, I'm a partner and co-founder with Emotionally, which is an online therapy platform for corporates, for individuals, basically looking for therapy.
Wow.
So that's, in a nutshell, what I am.
You're doing so much stuff. How do you get the energy to do all of this? Where does the passion come from?
I wish I could do more until I have the energy. I need to sensitize more people, create more awareness on what mental health is all about. And the time that I got into mental health was, we didn't even know what psychology was all about. And my dad wanted me to get into medicine. And here I am today, a psychologist. And before he expired, he did say, you should have done MBBS and not psychology.
So you have a mission in mind about how you want to spread awareness about therapy and mental health?
Yes. I've also already been on this path, on this journey. I started off my career with children with special needs. So I set up 3 different special schools, one in a rural area and 2 in Delhi NCR. And I worked in the Tijara district of Alwar, which is covering 90 villages to pick up children with disabilities and train the voluntary health workers to start doing therapies. I'm not talking about way back in the 1985, 86, 87. That is the time that people were not even talking about mental health or disabilities or inclusion.
Correct.
And currently also, I don't spare a minute where I'm not, talking about mental health or helping someone with mental health issues. I'm willing to work even late at night because if I'm working for individuals from various countries, I'm ready to do all of that. That's the kind. I really want to. I'm doing a lot of training programs. Mm-hmm. I teach at the hospitals for the DNB students, whether in pediatrics or psychiatry. I teach all that.
But Dr. Roma, do you see a change over these years with regards to the way people are approaching mental health? Like, what is the current situation with the way people approach mental health in India? Is there a taboo around it? Is it still there is a stigma associated with it? How do people think about mental health?
So yes, there is a very big change, especially in the 2020 that the COVID has come in there. People have started talking about mental health. They are connecting to psychologists and therapists and psychiatrists on various platforms. And especially a lot of mental health apps have come in, during this time. People are talking about it, but the stigma still remains. The taboo still remains. I have clients who've been coming in and saying that, we're not allowed to come in for therapy. We don't tell people that we're coming in for therapy because our parents would say that, why don't you talk to us, why don't you connect with us? We are your best friends and we can tell you, we can help you. So it's like a psychologist is kind of labeled as a friend, which a psychologist is not. A psychologist is completely a different field, In the earlier times, yes. From the time I started getting trained, people were not talking about psychology. I remember sitting in Ganga Ram Hospital as a consultant And I had no referrals for the first 6 months. And I would sit with my Reader's Digest or a journal and read during my OPD hours. And then I told myself, this is not going to happen. I went into every room where a doctor would sit, and I would go and introduce myself and tell what I do. And there, slowly, gradually, clients started trickling. There's a very big difference. So now when I practice, there's a difference in different parts of Delhi also. So when I'm in Gurgaon, everything is very different. People come in for their therapies. People come in to talk about mental health issues on their own. So I have children. I have individuals over the age of 80, and especially in the COVID, I was very, very happy to hear an 82-year-old woman wanting to get connected to a psychologist to talk so that somebody is there to listen to her. So people are coming in. Also now people are talking about relationship issues. Relationships are going through a lot of problem. There's volatility and confusion, multiple partners, all kinds of issues. So people are talking about.
And how should people start, the people who are listening to this podcast, start thinking about mental health? If they have an issue, what are the kinds of issues that they should see? How should they notice the signs? When should they come to a therapist? Can you shine a little light on these kind of questions?
It's not that I will suddenly show up with a symptom until I have got some acute attack. Only when I have an acute attack will I show up those bigger symptoms that people talk about. But I could be having a low mood for a period of time. I may just be in a room with the door shut or the curtains. It's like a dark room. Don't want to talk. My mood is very, very low. Or I'm very, very angry. I'm extremely agitated. That's another area where one can just pick up, and it's going on for a period of time. Or there's a lot of hiding happening. You're hiding away from any substance usage that you're doing, or you're wanting to go out of the house very often. Sometimes your alcohol in the house is getting missed. So just be on the lookout where your children are probably going to experiment and explore with that. Also, what is another area is that eating gets affected. Your eating patterns. Either you eat very less, or you're eating way too much and eating or munching way too much. Your sleep patterns get affected. You're either sleeping way too much, or you're not just sleeping, you're unable to sleep. Excessive crying spells. And, these are the bigger areas that you can actually pick up where a person may be struggling with some emotional health issues. And that is the time to help the person. Now, what happens when somebody is going through this? If the family is around, the family will just say, oh, come on, get out of your room. Come on, come and meet people. We wouldn't sit down and validate the person. Yes, you're going through an issue. What is it that I can do for you? Instead of what is it I can do for you, I will say, why are you doing this? So the person, when you ask a why, there's an attack. You feel like an attack, and so you're going to defend. Or we'll say, oh, you have a very big issue. You're getting so angry. You need to go and see a psychologist, or you need to go and see a mental health person. And there the person clams up, especially when you're going to school, So when you're going to school, and if a child behaves or the child is not listening to you, you're sent off to the counselor's room. So the other children feel counselor means you're mad, you're going to see a counselor. But when you have a stomach ache and you're going to the medical room in the school, everything's perfect. You have a toothache, you will go to a dental surgeon or a dentist to get yourself treated for it. Then if you have an emotional issue, why aren't you going to a psychologist? So I must tell people who are listening to this that going to a psychologist means that it's a slow process. It's not a quick fix. You've learned your thoughts and behaviors over the years. You've been influenced by a lot which is happening around you. And some of us have the ability to deal with it. Some of us just don't have the skill to deal with it. So it's imperative for us to talk, and somebody who can listen to us. So don't hesitate going to a therapist. It's not that we will do some voodoo stuff over there, or we'll make you lie down and we'll do all kinds of stuff. No, we'll just listen to you. So a lot of clients would come and say, oh, she's just listening to us. Why would she charge us to listen to us? So, we need to educate and create more awareness what listening is all about and how we can encourage people talking.
This is a lovely point that you made. What should people expect when they come to see a therapist for the first time? Like you said, is there voodoo that's happening? Is there a couch that they'll make me lie down on? Is there a box of tissue? We have all these mental images from movies that we've seen, from pictures that we've seen. So what was a typical session look like when someone comes to a therapist?
So usually the first session is just getting in more information about what the client is going through. And it's always like, come and introduce yourself, tell each other what is the role of the therapist or how long the session is going to last, and what is it that the therapist is going to do for you. Listen to the problem, the presenting problem that is there. And probably towards the end of the session, we'll paraphrase and help you and give you maybe 2 or 3 tasks to introspect or reflect and tell you that how the therapy is going to move on from here. And depends on what the issues the person is coming in for. Is it an individual? Is it a couple? Is it a family? Is it a teenager? What is the issue that is coming? Is it a referral from a school? Is it for a psychodiagnostic? So it is all very, very different. So when we have children coming into the clinic, the parents would say, you better go and behave properly over there. So the child is already scared. I don't know what I'm going to do. They'll tell a lie to the child, or they'll tell a lie to the individual who's probably going through mental health issues. And so the person does not want to talk. And a lot of us do not go to a psychologist only because there is a mental illness. So there's a difference between a mental illness and mental health issues like everyday issues, where you need counseling. But a mental illness is completely different. So people are forming that thought from the movies and from books or somewhere that, you go to a therapist and this is what is going to happen. It doesn't happen like that. We deal with normal people.
And that's a very important point. Do you think everyone should go into therapy?
I wouldn't say everyone should go in for therapy. I mean, there's no rule like that. But you must have someone with whom you can just talk, who will not shame you, who is going to listen to you non-judgmentally and probably help you deal with your conflicts and also help you change your thought patterns and to look at life differently so that you're at peace with yourself. You're much more happier and you're able to engage in conversations and be functional.
Exactly. It is not that you have to be broken to go to therapy, because all of us are going through so much. We have all our past baggage that we're still carrying with us. Everyone has that. And if we can have somebody show us how to put it down and continue walking, isn't that a beautiful thing? Imagine the amount of energy that we would have, the way that we would approach the world if we knew these kinds of techniques and these tools, which is why, it is not just for people who are going through something currently or, who feel that, they have a mental health issue. Even if you don't, go see a counselor. They will show you a different side to you, which will make you explore and, like you said, introspect, ask the right questions. That's something that we don't do.
So when a person comes in, and sometimes, we have individuals, exactly what you said that I've just come in. I don't know why I'm here for. I would just say, yeah, just sit down. Do you want to have a glass of water? Maybe you can just sit and maybe we can just chat. And we continue making a rapport formation with the client and talk to the person. Now, the therapist is never a friend to the client. That is some message that needs to go to people. We're not friends. We will listen to you. We're professionals. We are trained to deal with mental health, behavior, how to change that, how to be at peace with yourself, And we all have so many kinds of worries, thoughts. We're sad. We're anxious. We're probably getting into a panic. Go and speak to a therapist, And therapist is easily available in major hospitals, It's not that you have to go hunt for a therapist and it's very difficult. Major hospitals these days have therapists. Schools have counselors. Do not hesitate to go and talk to them. And there are so many mental health apps where you can still have your anonymity. If you feel privacy is the issue and you want to have that anonymity, you can go ahead. You can go ahead with an audio conversation with a therapist without showing up. We're not going to keep on stalking you. The therapist is not going to stalk on you. Therapist's aim is to listen to you, hear you out, and help you deal with it.
In fact, pre-COVID and all of that, when you had to actually physically go and visit a therapist, everyone used to have that issue. What if I see somebody that I know at the therapist meeting? What will people think if they see me entering this place, if they see me entering that place? And I remember this especially coming from small towns, when I had clients in small towns that telling me about this. And now the anonymity is there. You don't even need to go anywhere. You just need to make that little effort to put yourself out there, find a therapist for yourself and take it forward.
Yeah. So very often when I work from the hospital setup, although we have started off with face-to-face consultations now, otherwise it's all a lot very virtual and hybrid model is there. But there would be 2-3 clients who might know each other. And when the second client comes and asks me, why do you think that person is there? I said, I'm not allowed to share anything with you. You've come in with your issue, please sit down and we can talk about it. But still they would be, curious, why did that other person come in, So we don't share. So psychologists are trained to be ethical. And I always tell my clients, if I bump into you in a social area, I will never say hello to you. Keeping in mind that people talk of stigma and taboo, I will not go and say, if you want to come and connect with me, I'll probably say a hello to you, but I will not do a therapy session in a social setup. I will not even hear your problem that time. That is the kind of ethics that one has to follow.
Lovely, lovely. Before going ahead, we'll take a quick break.
Hello, everybody. Welcome to another great week on the IBM Podcast Network. If you aren't following us on social media, please do. We're IBM Podcast on Twitter, Facebook, and Instagram. Would like to thank the sponsors on the network this week, CED. We really do appreciate your support. We have a new show on the network. It's called The Fighting Goat. And if you love fighting sports, tune in every Wednesday with hosts Arjun and Somesh. They also featured, by the way, on Cyrus Says this week, where the three fitness freaks bonded over their love for TV sports and sports in general. Tune in to This Round Is On Me, where Gauri celebrated her 25th anniversary with Kavita Rajwade, who is my co-founder at the IBM Podcast Network. They give us details about how this show was curated, and they talk about podcasts in general. On The Habit Coach, Ashdin highlighted our addiction to screens, how we are glued to either a big laptop screen or a small mobile screen all day. He shared some tips on how to rectify this unhealthy lifestyle. On All Things Policy, Anirudh Kanisati spoke to Pratik Vakre and Rohan Sheth about the new internet guidelines that were issued by the Government of India recently and their impact on content creators and platforms. On the Filter Coffee podcast, Karthik invited Vivek Ram, who is a celebrated animation artist. They chatted about his stint with animation and starting his own studio called Vanar Sena, bringing to life stories from ancient India and his scriptures with animation as his vehicle. We had Dhanya Rajendran, the editor of the News Minute, on the Note with Maruk Inayat. It was a deep dive into the digital newsroom and the upkeep of truth in a fake news pandemic. And with that, let's get you back to your show.
And we are back. Doctor, how should somebody start looking for a therapist? How should they start, approaching this aspect?
So it depends. If you have a mental illness, which means maybe if you have a psychiatric area, which is probably a psychosis or an acute psychotic attack, you are into deep depression, or there's chronic problem, or there's chronic anger. That means the illness part is settled and it's been there for a long period of time. Do go in to meet up a therapist who is a licensed therapist who has gone through an MPhil degree, because an MPhil degree is the degree these days, which is a licensed therapist for mental illness, right? But if you have mental health issues other than these, which do not require psychiatric intervention and only needs a psychologist, then you will go meet up a psychologist who's been practicing in the field of mental health. And most of the hospital setups have psychologists there. They have a team of mental health professionals. You can go there and you can just connect with anybody. You can also, there are mental health apps which are easily available, and you can look at their reviews and you can see what you want to get help for. You can get help there. If you are looking for a psychiatrist, primarily for the medication part of it, a lot of people come in and say, give us medicine to put us off to sleep. We'd like to sleep. So that's not what we do. So a psychiatrist will deal with the other areas. So a psychiatrist is basically a person with an MBBS degree and then an MD and a super specialization with any of the mental health areas. But a psychologist is basically a bachelor's, a master's, an MPhil, a PhD. So a lot of them will not be an MPhil. So if you're not an MPhil, you're not a clinical psychologist, but you may do a BA, MA and a PhD and yet be there to listen to people and counsel. So we are counselors, we will listen to you.
So there is a counseling aspect and then there is a doctor medicine aspect, right?
Yes.
These two are very different things.
Yeah.
How would somebody know if their issue is acute enough to go to the doctor medical aspect of mental therapy?
So usually you have a physician.
Okay.
You do have a physician. Most of us have our own physicians. You can connect to the physician And that physician would probably give you some help and in referring you to the person who's a mental health specialist, whether a psychologist or a psychiatrist. There are also so many groups these days, I'm in Gurgaon. So we have a Gurgaon Moms, which is a huge platform. And anybody who has a question there puts in there, and there are like N number of people giving you an answer. Who should you go to and who should you not go to? So there are people who will give you that assistance, I would say just don't hesitate. Go even to a physician. Get help. Don't wait for another bigger issue to happen, because emotional health is deep-rooted. And there are conflicts which are deep-rooted. And especially with COVID, because of the social isolation or the pay cuts or loss of jobs or just working from home, there's huge anxiety and panic attacks, and there's depression, and relationships which are an issue. Do not hesitate going and talking to a person.
I love this. If you're listening to this and if you've been wondering and teeter-tottering on the fact whether I should go, whether I should not go, who should I speak to? I think as soon as you finish listening to this podcast, just go and find somebody who you can talk to. And asking for help is perfectly fine. It doesn't make you, there's nothing wrong with asking for help. And the faster you get help, the faster you can recover, the faster you feel better. And ultimately, that's what we want, right? We want vibrant, full lives. And this is just one way of giving us that vibrant, full life.
So if I have pain, which is physical pain, I'm okay going and talking to a doctor. Why? Because it's socially acceptable. If I have emotional pain, I really have emotional pain. I can't deal with so many things. Why am I hesitant to go and speak to another doctor who is dealing with emotional health issues? Why? Why should I put myself into so much of trouble and struggle? There is no need to struggle. Go talk. Half your problems will just come down. So I always tell people there's a difference in complaining and venting. So go and vent to a therapist. It is very productive.
Beautifully said. Doctor, I think one aspect of this is, for example, in school, we're taught about anatomy. This is your hand, this is this, you have kidney, you have liver. Nobody tells us about the anatomy of emotions, right? How many emotions can somebody actually convey or talk about? Many people can only get up to 7 emotions before they start blanking out on it. But like, for example, if you look at like Plutchik's wheel, there are so many. And if you only understand the vocabulary of emotions, you can actually start expressing yourself better because now you understand what it is that you're actually feeling.
So there are clients who would just come and say that I'm feeling very guilty. I'm very guilty about doing this. I'm guilty about doing this. Now let's look at that part that you're feeling guilty and substitute it with another emotion, and it will not make you feel so negative. It's everything cannot be related to anger. Any behavior that is affecting does not turn into anger. There has to be other emotion. And the best part is where people can use so much of those emoticons on the, the groups. So if we can use all those emoticons, why aren't we addressing our own emotions with those areas,
Correct. People just say, I'm feeling sad. I'm feeling bad. Bad matlab kya? You can be, I'm feeling vulnerable. I feel that somebody has, taken me for granted. Whatever it is, but like, can you at least start expressing what it is that you're feeling a little bit more? And you'll see half your problems start disappearing because you understand that emotion that you're going through. I think understanding these emotional anatomies are so important.
Yeah, and in the last year, we have had so many clients because of celebrity suicides. It is mind-boggling how children have actually suffered from this and how they're still struggling with all of this. Were we waiting for this to happen and talk about it? I think we should just be talking about it and dealing with these issues. Are we waiting for a celebrity to say that I have mental health issues and so validate it for us? No. I think if I have a problem, I have the right to go and get that assistance and help. And I have individuals now who are talking about it and saying, not a celebrity, but people like you and me and everybody talking about that. Yes, I have issues. Yes, I've gone through depression. I've gone through panic attacks. I've gone through anxiety. And this is where I am today. And this is my journey. So people learn out of those journeys.
Absolutely. I remember when I went for therapy for the first time, it was all those thoughts about taboo did come. All those thoughts about, what will people think did come. Should I tell people? Should I not tell people? Did come in my mind. But the amount of value that I got from those therapy sessions was mind-blowing, right? Because the way that she, made me introspect about my life or the things that have happened, it completely changed the way that I look at the world. And I 100% believe the person I am today is only because of those therapy sessions. I would be a very, very different person, stuck somewhere, God knows what sort of PTSD, if I had not gone for those therapy sessions. So I know that it makes a big difference to the way that you approach life.
Yeah. So also, I'd like to tell people who are going to listen to this that even psychologists and psychiatrists go in for their own therapies also. And it's perfectly normal to go in for those therapies. We hear so much of negative information which can affect us. And sometimes we need to be reviewed by our peers to understand, am I taking that client into the right direction? So that supervision is also required. It's perfectly normal to do that. So I think we need to create more and more awareness to go in for therapy.
Yes, absolutely. Doctor, when somebody goes in for therapy and meets a therapist, how should you choose the right kind of therapist? If you're not comfortable, is it okay to switch? Should you be, what should your equation be like? Some people said that, it is like trying on multiple things and seeing which person fits you properly. How should you, think about that?
I think if you have gone to a therapist and you are not comfortable with that therapist, let that therapist know that I'm not comfortable. Maybe the therapist will use some other techniques to help you deal with it. We're also learning, and I would not advise keep on changing your therapist, because what are you looking for? What is your priority in life? It's like dawai change karte rahenge. Are we going to keep changing the medicine, the salts? What is it that I'm looking at? What help do I need? Where am I getting stuck up in? And supposing you are feeling that you are not connecting to that therapist, then ask for a referral from that same therapist. That therapist has other peer groups who he or she can refer.
And the person shouldn't feel bad about saying that, or I'll hurt my therapist's emotions.
No.
Okay. So
it has happened very often with us.
Is it like talking to a doctor and saying, I want a second opinion? Is that the general feel for that kind of a conversation?
No, I don't want a second opinion. I'm just feeling that I'm not able to connect with you.
Okay.
And I'm feeling a little hesitant talking. Is it that you can help me either with you as a therapist, or would you want to refer me somewhere else?
Lovely.
So very often there are families who come in, and if you have to take up individual therapies, so we do not want to take up individual therapies for the entire family. We'd refer that other individual to another therapist so that there's no clash.
Correct. I think that's the most important, because, keeping the bucket separate. This person is different. This person is private. Everything that you say is going to be private in whatever we discuss. You can talk about anything without being judged. That is such a safe space. And that safe space is what we need to start creating. And like you said, it's not going to happen with your friends. It's not going to happen with your family members. Like Dr. Roma said, that they are specialists, right? It is not that they become your friends. That's not the objective, right? They are doing a job. And that is the most important thing to take on board, saying that you need to go to a professional. It's not like if you had, like you were mentioning, if you have a toothache, your mom will say, jara clove oil laga lo, ho jayega, right? But you needed a root canal and you've started putting clove oil. That is the difference in saying that I will talk to my friend. And also what I've noticed is that when you talk to a friend, because they're not necessarily trained, they're giving advice. And it's not necessarily that you need advice at that point of time, right? You need probably a mirror.
Yeah. You just don't need advice at that time. Somebody just needs to listen to you, validate it for you, hear you out, and maybe give you a suggestion, but not an advice as such. You don't really need an advice, You need to be heard. And the gravity of the problem or the gravity of the situation can decrease, especially if you go and talk it out. You just unburden yourself. But I must say, do not look for a quick fix. It takes multiple sessions to be able to help you introspect, reflect, change. And I cannot change the world around you. That's not what the therapist does. The therapist will help you change your own perspective and change how you see things for yourself, how comfortable you are if you change that thought, and how you see your life and your journey. In your journey, you've had so many interactions, so many influences, so many kinds of, behaviors which have come in. or so many connections. So you learn from all of that.
Absolutely beautiful. Absolutely beautiful. Because it takes 35 years to get you to where you are. You can't expect it to change in a week, right? It is going to take its own sweet time to change. And I think that is important for us. To put things in perspective, the first is, start observing yourself and seeing if you do need to reach out to somebody just to talk, just to understand what is it that you're feeling or going through. If you're going through an emotional state right now, something might have happened in your life that you need clarity on. I think this is a good time to then reach out to a counselor. You don't need to wait for it to become acute. Wait for it to become something worse and then start thinking about it. You can probably start earlier on. I think that is a very, very important point that you mentioned. The second thing is start looking out for a therapist. Like you said, you can go to a hospital. You can go to online. There are lots of apps. Any apps in particular that you suggest?
I would not like to name any one of them.
Okay. So explore, learn, figure it out. Okay. Lovely. And start searching for therapy, going and, I think a large part of this podcast was understanding that it is perfectly fine to. Let's remove this taboo around it. Let's remove the stigma. If you're going, tell your friends, right? If you're going, tell your family. It is fine. Eventually, I think you have to get them into your fold because then it can't be your secret meeting. And I feel that secret meeting again prevents your therapy sessions from maybe being as effective.
Yeah, actually, and it's important also. I have had children who've gotten their parents after coming in for therapy. They've gotten their parents that, look, I've got help here. So you need to listen to this person and hear this person, what this person is helping me out with. Very often I've got, your colleagues who've gotten friends, So those colleagues can also help. And if you see that that person is crumbling or the person is actually having an attack, do not hesitate in taking that colleague of yours to a therapist or a psychologist because immediately some help can be given. Crisis intervention is most important. So we can intervene in that crisis and help you.
Okay. So it is not that only when you are ready should you go. I can also handhold you and take you.
Yes.
So that is important. How should somebody broach the topic to a person who they see, like you said, is crumbling? Or like you said earlier, sitting in dark rooms, curtain closed, spending either too much time on the internet, trying to be away from people. Like you said, those things. How should somebody broach the topic saying that maybe you need to go for therapy, maybe you need to speak to someone? How should someone talk about it?
So, because of the stigma and taboo, people, when you go and say maybe you need therapy, they will just close up. They will not talk. Maybe if that's a family member, just sit with that family member, chat about normal transactional things, not anything to do with an illness. Just chat. Let that person feel connected and let that person also know that I know you're sitting in a dark room. Is there something that is affecting you? Can I do something for you? Would you want me to help you with something? Let that person know that I am there. Instead of bouncing on the person and saying, you need to be taken somewhere, you are lazy, you are not doing this, that becomes even more difficult for that person because that person is already struggling. Let that person slowly, gradually open up, right? And, people in the family can just hear that person and then say, we all need help because probably I'm going through a problem. Why don't you assist me? Why don't you help me? And take this person for help. And there are always feelers before this. It is not way too sudden. There are always some kinds of feelers, some behavioral changes which are there. So the family needs to look out for those changes, The person may be just missing out on so many things or poor grades happening, sudden regression in academics happening, There are so many things which can be there. And if you've lost a partner, if you've lost a family member, that's another very big area because you're grieving, you've just not grieved. So how would you heal? And we're waiting for that person to heal, but that person hasn't gotten over grieving. Let that person grieve. We all grieve differently.
And there are times when people have been grieving for years and years and years and years and have not gotten out of that block. And it's a constant drain on their system. You can see them going through it. And it's almost like you wish you could say something, but you can't because you don't know what they're experiencing. But, that is where a person who's been taught how to deal with these kind of situations comes in. So important to learn grief, guilt. These are those emotions that are very, very heavy and weigh you down so dramatically.
Loss. Loss of a friend. Loss of a friend would mean that friend has deprived me of the friendship, but has gone to somebody else to be friends. That loss, it's a huge loss. It's an emotional loss. So you need to talk about it because you start feeling rejected.
Correct.
So the feeling of rejection, how do you deal with that feeling of rejection? Irritability, the emotions that you were talking about, we hardly talk about this, We only say I'm feeling bad, or I use this term very loosely as I'm depressed. Depression is a clinical term. You can't use that depression, I'm depressed.
Correct. I'm depressed. And, like we were saying, that I'm depressed is that you have upnowed it. It is now you, right? You have depression. You have a toothache. You're not a toothache.
Yeah,
and it is important to make that change, right? Imagine if you were a toothache, what it would be like, right? So it is not that I am depressed. No, I have depression. And just like I have it, I can not have it also. But if I am depression, I cannot not be depression, right? Then your identity changes. So, these little subtle things are so important for all of us to start discussing, and start having conversations on. I absolutely love what you are doing, the way that you're spreading your message, and the vitality and vigor with which you are doing so much. Absolutely superb, Dr. Roma. Thank you so much for what you're doing.
Thank you so much.
Dr. Roma, how can people get in touch with you? How can people connect with you if they have further questions?
Okay, so I can share my email. Mm-hmm. It's romakumar64@gmail.com.
romakumar64@gmail.com. Lovely. Would that be the best way to connect with you? Any websites they should go to?
They can go to www.emotionally.in.
How is that spelled?
EMOTIONALLY.in.
Okay, emotionally.in. Perfect. Lovely. Thank you so much, Dr. Roma, for coming on the Habit Coach podcast. It was an absolute pleasure talking to you.
So start these habits and share with us your progress using the hashtag #TheHabitCoach. If you like this podcast, don't forget to check out other interesting podcasts on the IVM network. You can listen to us on the IVM Podcast app or ivmpodcast.com. You can also follow us on social media. We are at IVM Podcasts on Twitter and Instagram. If you want to reach out to me, I am Ashdin Doc on Twitter and Instagram. You can find lots more information on my website, awesome180.com, or check out different content on my YouTube channel called AWESOME180. That's Awesome 180.